The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Welcome to Pain Free Today. I'm your host, Denis Thompson. We've been asked a number of times if I could give out the number for people to ask a question here on the show. That number is 888-565-1470. That number again is 888-565-1470. We're not here to primarily diagnose any issues. We're here simply to introduce you to a totally new way of looking at pain. Wherever you have pain is where the problem ended up. It is not at all where it's coming from. It is our belief that all pain is coming from a neurological origin creating a physiological symptom. So what we've done is we've created a brand new therapy we call the ARP Wave System neurotherapy. And it is a 3-step program. And we're training doctors throughout the entire world in this therapy. And if you are a provider, we would love to have the opportunity of demonstrating this therapy to you and show you how effective it is as an addition to what you're presently doing. So if you're a patient, if you are in pain, if you have restricted range of motion, if you have been told you're bone on bone and need surgery, if you've had a surgery and it just didn't do what you thought it should do, we have doctors in the area who would be more than happy to allow you to see firsthand if neurotherapy can be the resolution to your problem. The system is a 3-part system, and it's based on a very simple premise that everything in your body is controlled by your nervous system. The nervous system is, say, like a CPU or the main software in a computer. The nervous system drives everything. So if you have pain, wherever that pain is, it's coming from a neurological origin at a completely opposite end of where you think it's coming from. What we do in our system is we identify, first and foremost, is the nervous system working correctly? If it is not, then consequently your body is not going to be able to do what it is supposed to do, and the muscles in your body are not going to be able to absorb force coming into your body, and that force is going to go someplace that it's not supposed to go. So think of your muscles as shock absorbers, and think of your nervous system as driving those shock absorbers. If your nervous system is not sending the proper electrical signal to those muscles will not do what they're supposed to do, which is act as a shock absorber. And because of that, you would have joint pain. So wherever you have joint pain, everyone's treating your joint. The joint's not the problem. The joint is where the problem ended up. If you have a tear, if you have a ligament tear, a tendon tear, that is not the problem. The problem is how you got the tear. And how you got the tear is the muscles did not do their job neurologically, not physiologically. You could be the strongest person in the world and still get a tear. Reason for that is that muscle didn't turn on fast enough to absorb that force coming in. So what we do in the first step of our three-part system is we identify, is the nervous system working correctly? And we do that by simply testing your muscles. Very, very easy test. We call it an external EMG. And when we test that muscle, we're testing that muscle to see, can it absorb force? If that muscle cannot absorb force, then we know there's going to be a problem, and we also know that the nervous system kind of has an electrical short in it. And so ask yourself, if you were an electrical appliance and you had a short in the electrical appliance, would it work? And of course the answer is no. Well, then ask yourself another question, and that is, does it make any difference where that short is? And again, the answer is no. Well, we believe the human body is the same way. It is an electrical appliance, and if there's a short anywhere in that electrical appliance, you're going to have a problem someplace. So the first thing we do in step number one is we identify, is the nervous system sending the right signal to the muscles to allow them to absorb force? If not, then we have to reset the nervous system, very much like you would reset a computer. And we've created a protocol to where we actually basically send signals directly into your muscles with one of our proprietary tools, which allows the nervous system to turn on that muscle to where it absorbs force. That's all we're looking for it to do. So once we've gone through step one, we now have to go in and identify, where is the electrical short? Think of us as an electrician now. We're looking around the body for an electrical short. For the providers listening, what we're doing is we're looking for cellular disruption. We're looking for sodium-potassium leakage, and that indicates there's going to be scar tissue there. And wherever there's scar tissue, there is an electrical short. The cells can no longer communicate because they're walled off with scar tissue. So we identify those areas that are electrical shorts in step two of the neurotherapy system. And in that step, once we identify where that signal is not working correctly, we get that signal to work correctly. Once we do that, the patient usually is quite amazed because they might have pain in their elbow and we might find a short coming back out of their back. So wherever we find that short is where the therapy takes over and we start to work on the therapeutic side. So in step two, we identify exactly where the electrical disconnect is, and then we begin to work on that area and retrain the patient in how to move efficiently. Because if you're consistently doing the same thing that's causing you pain after a therapeutic session, you're sending a neurological signal constantly that there's still a problem. So unless you break that pattern of movement, unless you break what we call a compensation pattern, under no conditions are you going to be able to resolve that problem. And unfortunately, that compensation pattern is not, as previously believed, a physiological pattern. We believe it's a neurological pattern. And so therefore, we have to neurologically retrain you on how to move correctly, which means that you're going to be sitting in a chair differently, you're going to be standing differently, you're going to be walking differently, you're not going to be favoring one side to the other, because as you do that, you're reinforcing that neurological statement that you have a problem. So in step two, we begin to break and retrain, re-educate, neurologically re-educate you on how to move efficiently without pain. Let's be honest. If you're in pain right now, if you have pain on your right side, you're shifting everything to the left side. Conversely, if you have pain on the left side, you're going to shift everything to the right side. That's normal. You're going to move away from pain. But when you do that, and you take a medication, or you have a shot, or you have a block, do you think that changed that pattern? No, because that pattern is neurologically embedded based on the first information you got, which was you have pain. So even though you do not have pain any longer, you still are reinforcing the fact that you have pain by your movement pattern. Providers, what we do in this step is absolutely 100% critical. What we're doing is we're neurologically reestablishing a new pattern of movement. A new pattern of movement that doesn't reinforce the fact that we have pain. Example, if you have pain in your shoulder and you cannot raise your arm without pain, you are not going to raise your arm. But in step 2, if we get you to raise your arm without pain, then you're going to be able to raise your arm because your cognitive brain now says, well, hey, I can do that without pain. So that's what we're doing in step 2. We are basically reestablishing the fact that you can move freely without pain, and therefore creating that as your new pattern of movement rather than your old pattern of movement. And by breaking that pattern of movement, we're breaking the cycle that says you have pain. So the second step of our system is very, very important, and that is reestablishing a new pattern, identifying where the electrical short is coming from, not where it's ending up, and treating you, the patient, in active range of motion to create a new movement pattern. And folks, trust me, this therapy is extraordinarily effective because what it does is it works on where the problem is coming from, not where the problem ended up. So if you have an MRI, if you have an X-ray, if you have a CAT scan, if you have any type of diagnostic imaging done, that imaging, that diagnostic test, that ultrasound, any test tells you where the problem ended. It does not tell you where the problem came from. Now think about that for a second. How can you get rid of a problem unless you address what caused the problem? And the answer, of course, is you can't. And that's why we have millions of people living on pain medication 24/7, 365. Because we have not solved the problem. We have hidden the problem, but we certainly have not solved the problem. Now, the ARP Wave System neurotherapy is not a panacea. It's not it doesn't cure anything. It doesn't, resolve 100% of the issues. But I can tell you, it is a dramatic change in the way we presently address therapeutic issues. Pain is our number one incidence in this country and throughout the world. Listen now to how you can try the system at absolutely no cost or obligation to you.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 888-562-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back. I'm your host, Denis Thompson. This is Pain Free Today. If you'd like to ask a question, please don't hesitate. Give us a call, 888-565-1470. What I'd like to do right now is just take a moment to ask you, if you are in pain anywhere in the listening audience, and you have been in pain for a prolonged period of time, please give us the opportunity to see if we can help you. Now, we have doctors throughout the entire world who we've trained in our system. And if we do not have a doctor in your area, we will get one specifically for you. As a matter of fact, what I tell all the patients who write in and call in on these different shows throughout the country is do this. After you get off the show, call your doctor, ask them, do you offer the ARP Wave System neurotherapy? If they do not, then ask them if they would mind if you were treated with the ARP Wave System in their office at no cost or obligation to either of you. And here's how that would work. We would send you, if you're in an area where we do not have doctors, if you're in an area where we do not have a representative, we will send directly to your doctor's office our proprietary system. We will then set up a time which is convenient for you, the patient, to be treated in the doctor's office. We will treat you over Skype, on the internet, self-directing the doctor's staff person on exactly how to administer our system. You will go through the three-part system. You will go through the evaluation. You will go through the what we call cellular disruption stage, where we actually find the neurological disconnect. You will then go through your first treatment. At the end of that first treatment, you will know beyond a shadow of a doubt, that'll be about 30 minutes into it, you'll know beyond a shadow of a doubt if we can help you or not. And if we can, then you simply agree to be treated in the doctor's office for our system, which is 20 sessions. If it didn't work, then you agree to send everything back to us, no cost, no obligation to you. That's for anyone listening to this anywhere outside of the Tri-County area here in Florida. This show reaches, obviously, way further than that because we had patients come in from as far away as Puerto Rico in the last week from the show. So we know it has a far-reaching effect. So if you're in an area where we do not have a doctor or we do not have a representative who are setting up doctors, then take us up on that offer. It costs you absolutely nothing. And let's be honest, there is only one way to know for sure if neurotherapy is going to help you, and that's to try it. And if it costs you nothing and there's no obligation and it's done in your doctor's office, what do you have to lose? Now, if you're a provider out there and you're listening to this, you can tell that we are basically reaching out for patients, looking for doctors. We have patients for you right now. And if you have any questions about how the system works, please give us a call. Contact us at 954-256-0045 or on the web at painmanagementnetwork.com. let us show you. We'll treat you, we'll treat anyone in your family, or we'll treat your worst case patient, with the understanding that once you see the system in action, once you see the effect of what it does on the patient, once you understand the economics, you agree to be a provider if we have shown you that this system is as powerful and as effective as we're saying it is. That's all there is to it. You have absolutely nothing to lose, whether you're a doctor or whether you're a patient. There's really only one way you're ever going to know if this therapy is going to work, and that's to try it. Wouldn't you agree? So with that in mind, I've had quite a bit of mail, and one of the most common questions is, what does this do for MS? Well, it doesn't cure anything, but I can tell you it's going to dramatically change the quality of life of every single MS patient out there. Now, that's a pretty broad statement, but we treated thousands and thousands of MS patients with almost identically the same result, and that is that they've come to us, they're either have lost a tremendous amount of strength, they've lost mobility, they're suffering from rigid muscles, they're suffering from spasticity and tremors. And one of the things that is very, very, very effective is neurotherapy, because we're dealing with a neurological dysfunction. Think of it as a massive electrical short if you have MS. As you've been told, the system is not able to send the proper signals throughout your body, so it's like a big electrical short, to make things simplistic. What we do is we use an external source to send those signals, and great things happen. We've seen immediate release of rigid muscles. We've seen immediate elimination of spasticity and tremors going through the therapy. And doctors, this is a long-term need condition. This is something that the patient doesn't come to you for 20 sessions. They basically need to have our system in their home for basically the rest of their life. I tell anyone with MS, whether it be fibromyalgia, whether it be any type of chronic pain, you're either going to be addicted to drugs for the rest of your life, or you're going to be addicted to neurotherapy for the rest of your life. It's just that simple. The difference is, if you're taking drugs, obviously there's many side effects. You're going to be a little bit groggy. You're not going to have the active lifestyle that you normally would have. And with the ARP therapy, with the neurotherapy, you're going to be having a constant stimulus. You'll gain strength. You will have an active lifestyle that you normally would not have, and there are no side effects. And once a month, they're going to be monitored by you, our medical provider, and in the interim period of time, the 24 days that they're not being monitored by you, they're being monitored by the ARP Wave System staff. So with MS, again, it doesn't cure the disease. It doesn't work on the disease. What it does is it dramatically improves the quality of life. One of the things that we've seen is a tremendous loss in strength. Well, if you stop and think about it, if you're a healthy human being, typically you are able to send a neurological signal to your muscles to contract your muscles at 2 times a second. That's it. Whether you're a professional athlete or whether you're a housewife sitting at home right now, you're able to neurologically send signals 2 times a second to your muscles. With the neurotherapy in our proprietary tool, you're now able to send that signal at 500 times a second. Now, that in no means says your muscles are contracting 500 times a second. What it says is the muscle is getting a signal to contract neurologically that many times. So the end result is dramatic improvements in strength, dramatic improvements in muscle girth. And we have studies that demonstrate that tremendously. We did a study for the Orthopedic Society, the Research Society, and soon to be published, which shows a 326% change in thigh girth and density of muscle mass in a post-operative patient. Now, if we can do that post-operatively, imagine what we can do pre-op. So the answer is not, is it a cure? No, there's nothing that's a cure. And I'm not a doctor. I'm not here to tell you that it's a satisfactory treatment for the disease. I am here to tell you that we have had tremendous success in changing the quality of life of many, many MS patients. And to me, that is a tremendous, tremendous benefit. Because if we can get you more mobile, and if we can get you stronger, and if we can stop the tremors, and if we can stop the spasticity, and if we can stop those spasms, your quality of life is dramatically, dramatically changed. Think of it this way. Just because your brain can't send the right signal to your muscles to allow them to do what they're supposed to do, does not mean an external brain can't. So think of the neurotherapy basically as an external brain, and it's basically telling your muscles what to do. It's kind of like a jump start, and once they pick up on that signal, they will immediately start to respond to that signal. So hopefully for the listeners who have sent in their emails on the subject of MS, hopefully that answers the question. But again, you would have to go through the entire system. You would go through the initial evaluation. Once you go through the evaluation, you'd go through 20 sessions. Once those 20 sessions are up, at that point in time, you would go into a long-term program. And then once a month, you would go back to your provider, your doctor, provider of the neurotherapy, and you would have your plan evaluated to see if we need to make any changes in that plan to improve your quality of life. So for the next 60 months, you will be visiting your provider once a month at absolutely no cost to you. So I hear our sounder. Please listen to the important message that you are about ready to hear to see how you can try neurotherapy in your provider's office.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back, and welcome back to Pain Free Today. I'm your host, Denis Thompson. If you'd like to ask a question, please give us a call at 888-565-1470, and we'll try to get you on. If you'd like to ask a question via the web, please contact us at painmanagementnetwork.com, or you can call locally at 954-256-0045, and we'll try to get to your question as fast as possible. Well, this part of the show, usually I take to answer emails, and we've been flooded with email requests for a variety of different issues. One of the things that I'd like to take a moment to discuss with you is we are in the process right now of working with a lot of orthopedic surgeons in the post-surgery side of the equation. So much so that we have a surgeon now in creating a pilot program for us in a major carrier, where when a patient comes out of surgery, they will go into the neurotherapy system in the hospital, where they will have electrodes placed on them in the recovery room. They'll spend a couple days in the hospital if that's their normal hospital stay, and then they will take the system home with them, being monitored constantly by the staff of the orthopedic surgeon. And what we're finding by doing that is we're able to dramatically increase blood supply, so therefore we speed up the healing process. One of the other things that's very, very interesting is that the orthopedic surgeon that we're working with said that over the last 20 years, for the most part, one of the biggest obstacles they have is post-surgery atrophy. In other words, the muscle starts to lose strength, its ability to function properly. And if you have it on your right leg, your left leg is a little bit more muscular than your surgically repaired leg. And range of motion was a problem. We've been able to identify that, again, wherever you need surgery is where the problem ended, not where it came from. So the surgeons are fixing where the problem ended up, but they're not fixing where the problem came from. And where the problem is coming from, again, is a neurological disconnect. Those muscles aren't doing what they're supposed to do. If you're bone on bone, your shock absorbers aren't working. And the shock absorbers in your body are your muscles. So if you're bone on bone and you have pain and you have restricted range of motion and you've been told you need surgery or you've already had surgery, let's just say you've had surgery and you still have pain, you still have restricted range of motion. There's a reason for that. And the reason is not because the doctor didn't do a fantastic job of the surgery, but the doctor didn't solve what caused the problem. The doctor solved the end of the problem. And they're extraordinarily skilled at doing that. But again, if you're working on hardware and it's a software problem in a computer, you're not going to be that successful. And so what I'm saying is that the ARP Wave System, neurotherapy, addresses the neurological origin for the reason you need surgery. Why do you suppose that if you're 40 years old and you have a brand new knee, the doctor's going to tell you, well, with the current technology now, this might last, 20, 25 years, where 10 years ago, with the current technology, it would last 10 years or 15 years. So why would you need a new joint if you just put in a brand new joint? Well, the answer is, all you've done is fixed where the problem ended, not where the problem is coming from. Where the problem's coming from is relatively simple to understand. Your shock absorbers, your muscles, if you have a brand new knee, your muscles in your legs aren't absorbing force. Now, don't confuse that with strength, because you could be the strongest person in the world and still not be able to absorb force and still be bone on bone. Strength doesn't have a thing to do with it. Strength is a physiological component. Absorption of force is a neurological component, and they are dramatically different. Strength coaches throughout the world train athletes to become stronger. Does it prevent them from getting hurt? No. Why? Because getting stronger doesn't equate to ability to absorb force. And if that force is coming into your body and it's consistently bypassing your shock absorbers, it's just like an automobile. You are like a car with no shocks. And if you're a car without shocks, all that force is going to be going directly to the frame of your car. Well, the frame of your car as a human being is your skeletal structure. And that tissue is not designed to absorb force. There's only one part of your body that's designed to absorb force, and that's your muscles. And if your muscles are not absorbing force, it's going to areas not designed to absorb force. Henceforth, surgical need. So we do surgery, we put a brand new joint in, and now what happens? Now all the force starts going into the new joint, still bypassing the muscle. What we do with the ARP Wave System neurotherapy is we address and find out where the origin of that disrupted signal is coming from, causing the muscle not to do what it's supposed to do, which is absorb force. Now, when you stop and think about it like that, it's pretty simple. So if you have pain anywhere in your body, you have pain in your wrist. They call it carpal tunnel. Where's the pain coming from? It's certainly not coming from your wrist. Where's it coming from? And why do you have it there? Start asking yourself the question why, and just keep asking the question why until you come up with the answer. So let's go through a little exercise. Okay? You've been diagnosed with carpal tunnel. And there's no question you have an irritation in the carpal tunnel. No question. You have pain. You have restricted range of motion. Everybody is either going to treat you in that area or they're going to recommend surgery to get rid of the problem. So let's look at both of those avenues. If we treat the wrist, have we solved the problem? I submit to you, we haven't, because we have answered the where, but we have not answered the why. Why do I have carpal tunnel? Well, let's go through the answers. Well, I have carpal tunnel because I overwork my hand. I'm a court stenographer and I overwork my hand. Okay, so what does that really mean? You overwork your hands. What it means is you're overworking the muscles which control your wrist. And those muscles are no longer able to absorb force. So where does all the force go? To your wrist. The next question is, why? And where is the signal coming from? Well, the signal is coming from a completely different spot. So unless you have a therapy that addresses where that signal is coming from, do you have a therapy that's going to solve the problem? I submit to you, no. However, if you're a provider, you will now have at your disposal a way of identifying exactly where that signal is coming from and exactly a therapy on how to retrain those muscles to absorb force, keep the force out of the carpal tunnel, and what do you suspect is going to happen? Well, obviously, the patient is going to be without pain and have a greater range of motion. So if you look at anything that can go wrong, if you look at any joint pain, just think of it as that's where it ended, not where it's coming from. So there has to be muscles that aren't doing their job. Let's find those muscles that aren't doing their job, get them to do their job, transfer the force out of the joint. What happens to the pain? It goes away. Quickly. Immediately. So, providers, we have patients in pain. We'd like to send them directly to you. We'd like to demonstrate what I'm saying to you is accurate. There's really only one way you're ever going to know. I can talk until I'm blue in the face, but until you actually see this therapy in action, in addition to what you're doing right now. If you're doing physical therapy, this is an add-on. If you're doing occupational therapy, this is an add-on. If you're doing any kind of therapeutic exercise, this is an add-on. All of those are physiological treatments. This is not. This is a neurological treatment. It works on the software, not the hardware. Simple analogy. So every single one of you in pain, every one of you providers out there who have patients in pain, this system can be an extraordinary benefit to you and to your patients. But there's only one way, again, you're ever going to know if that, in fact, is true. And no amount of studies, no amount of experts, no amount of published articles are going to prove it to you. There's only one way you're ever going to know, and that's to see it in action. We're not experimenting here. We've treated over 75,000 patients with better than a 95% success rate. We treated the most elite athletes in the world and the most elite team athletes in the world. Not just the United States, the world. We know the therapy works. We've got studies to prove that it works. But those studies don't prove it to you. The only way you, as a patient, or the only way you, as a doctor, and one of our potential providers, is going to know if this therapy will work is to try it, to actually see what a patient sees and feels, to hear what they say. That's how you know. That is what we offer. So if you, as a provider, would like to have us treat one of your patients or someone, you or someone in your family, at no cost, no obligation, give us a call at 954-256-0045 or contact us on the web at painmanagementnetwork.com. If you're a patient and you're in pain right now, you have restricted range of motion right now, please reach out. Let us prove to you that neurotherapy can help you.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Denis Thompson. Hopefully, this has been a very, very informative 3/4 of an hour here. What I'd like to do at this point in time is answer probably the most overwhelming question I get from doctors, and I get the same question from patients basically all over the world. And that is, if this therapy is so darn good, why doesn't my doctor have it? Why haven't I heard of it before? Well, that's an extraordinarily good question. And here's the answer. When we started this business, when we started this to introduce this therapy 15 years ago, we could not get an audience with a doctor if our life depended on it because we didn't have any credibility, we didn't have any studies, and all we had was a burning desire to help people. And with that burning desire to help people, we created an organization to do just that. We ended up being the provider. We ended up giving the treatments. And we did that by starting a clinic in Minneapolis, Minnesota. And soon we were overwhelmed with that clinic. And then we wanted to figure out a way, how can we reach out to patients all over the world? How can we, after seeing what we've seen and after working with our providers here in our clinic, how can we get this out to more people? Well, the answer was the World Wide Web. So what we did is we created a plan. And that plan was extraordinarily expensive for us to do. But here's what that plan was. We would advertise on Google. And we would advertise for people who were told they need a new hip replacement surgery, a new hip replacement surgery, people that had chronic pain, people that had MS, people that had sports-related injuries, ACLs, MCLs, PCLs, et cetera, et cetera, et cetera. And what we would do is we would offer that person, no matter where they were at, the opportunity to experience one treatment at absolutely no cost or obligation, no matter where they were at. And here's how we did it. We pioneered telemedicine. We definitely pioneered telemedicine in the rehab world. And how it would work is this. We would send that patient out a piece of our equipment, extremely expensive medical equipment, at no cost and no obligation. We'd send them out a webcam at no cost or obligation. We would spend 1 hour of our time on a Skype or on the telephone with them, walking them step by step through our system. And at the end of that hour, the agreement was this. If we demonstrated a change in your symptoms, that you would agree to go into our program. And our program is basically 20 sessions, therapeutic sessions, administered by one of our therapists, done over the internet on Skype, and each session would take anywhere from 30 to 40 minutes. You would agree to do that if we agreed to send everything out to you, and you agreed to go into the program if we showed you that it worked, and you agreed to send everything back if it didn't work. Now, again, nothing's 100%, nothing's panacea, nothing, and nothing we said was diagnosing anything. We had you, before we sent anything out to you, we had one of our medical doctors administer and look at your medical history that you filled out for us, and then they would administer a prescription because it requires a prescription to utilize our system of neurotherapy. We would then do that therapy. And we treated over 75,000 patients all over the world. Some of the most elite athletes all over the world were treated in the same manner. If you hear about an elite athlete who came back in an extraordinary short period of time, chances are we treated them. Let me give you an example of what I'm talking about. For those of you who are football fans, there's a football player by the name of Dwight Freeney who's been one of our clients for years. The biggest story of Super Bowl, I believe it was 42, when the Colts were playing the New Orleans Saints, was, is Dwight Freeney going to play in the game? He had a grade 3 ankle sprain. For the providers listening to today, that means, as you all know, that he had a torn ligament. And he was stated that there's no way he would play. The normal recovery time for that injury is 8 to 10 weeks. We were 2 weeks out from the Super Bowl. We began working with Dwight 1 week prior to the Super Bowl. On Thursday of the Super Bowl, Dwight was free to play. MRI showed he was free to play. Folks, that's what we do. Now, the reason your doctor hasn't heard about us, the reason you as a provider haven't heard about us, is because we didn't reach out to you. In January of this year, we decided, after meeting with all the different providers throughout the country, after meeting with experts on Obamacare, we decided that the best way we now could help patients is set up the nation's largest network of professional providers, doctors and surgeons, administering our service to their patients. So in a year from now, I don't think I'll ever hear that. Why doesn't my doctor know about it? Because your doctor will know about it. Here's another way for your doctor to know about it. Give your doctor a call today. Ask your doctor if they would be interested in treating you with neurotherapy, the ARP Wave System neurotherapy, at no cost and no obligation to either you or them. And if you're in an area where we do not have a representative, we will send your doctor, just like we did earlier to the homeowner, we will send your doctor our system. We will walk your doctor's staff step by step through how to treat you. And at the end of that treatment, the only thing we ask of you and the doctor is, if it did what I say it does, you become a client. You, the doctor, become a provider, and you, the patient, become a client of the ARP Wave System in your doctor's office. Cost you nothing. So, as you can see, we're taking a very, very successful system, and we're just now putting it into professional doctors' offices, surgeons, whether they be neurosurgeons or orthopedic surgeons, doctors of all kinds. We believe this system is a tremendous addition to what you're presently doing. It does not take away from what you're doing. It adds to what you're doing. We've had many, many practitioners who've come on board in this year say that this was the thing that pushed many of their patients over the top. They could just not get there. They didn't get the success that they were looking for. They didn't get the relief of the symptoms, the increase in the range of motion. They were just something missing. And they all said to the person, this was the missing link. So, very gratifying to hear. So our job as a company is to reach out to providers and offer them the opportunity to offer these services. They are covered by insurance, all insurance. So there's really no reason not to do it other than the fact that you don't think it's going to work. And if we take away the fact that we'll prove to you it does work or it doesn't work, then you got absolutely no reason not to do it. So again, if you're a patient, give your doctor a call. Ask them if they offer ARP Wave System neurotherapy. If they do not, ask them if they'd be interested in doing so. If they say yes, great. If they say no, give us a call. Give us a call at 954-256-0045. And we'll set you up with a doctor in the area who will treat you. And again, there's no cost or obligation. And since we've been on the show, we've had many doctors come on board, and we've had lots of patients to referred to them. So it's a win-win for everybody. But most importantly, we're able to outreach more people and help more people live freely without pain. And of course, the name of the show is Pain Free Today. I'm your host, Denis Thompson. We'll be back next week. Have a great week.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.